Hope you're okay. Thank you for coming in. I've got a few questions for you. First of all, I'd like to know who you are.
Hello, I'm Nadia. I am an occupational therapist.
I'm Fiona. I'm an occupational therapist too.
And I'm Jenny. I'm also an occupational therapist.
Brilliant, thank you. So, to you, what is occupational therapy?
To me, occupational therapist is the person who can coming to you, to anybody house and supporting the people to live life better. And could be through the something we provide like equipment. It could be something we advise, and something we teach you. And so obviously occupational therapists cover all the age group, and we cover the most of the condition, whether it's the mental health, whether it's the emotional need, or whether it's a physical need. What about?
Yeah, I think we look at daily living, really, don't we? So we look at the daily tasks that you might have to do. So whether that's things that you really need to be able to do, like personal care, cleaning your teeth, housework, those sorts of tasks, or whether it's something you just want to be able to do. So maybe you want to be able to go and visit family, but you need some support in planning that route to get there. So it's really sort of, we're concerned with like daily living, and we work with people to support them to lead the most fulfilling life possible.
Yeah, to me it means working with a person as a whole person and looking at their whole life, and using their strengths to achieve the goals that they want, what's important to them, and this might be in their home or it might be outside in the community. And our aim is to maximise their independence, and empower them, and basically for them to be happier.
It is like to just, as Jenny said, to find the strength of the person and working on the strength to build it up. And we're not looking for the problem, we're looking for the solution, and what the solution could be in terms of the achieving anything the person may be lack in the life.
And it may be that the person thinks, oh, I definitely can't do this. This is a task that I can't do. So we're going to look at that task, and we're going to look at, is there a way that they can do that task? So can we break it down? Can we adapt it? Can we maybe in some cases put equipment in place, really to support that person, work with them to be able to achieve that outcome of being able to do that task.
Yeah, and if we're working with someone and there's something that we can't do, then very often we can put them in touch with people who can help them in that area.
So you guys are part of the, I think it's the Learning Disability Enablement Team, which is a bit of a mouthful. So
LD enablement.
Thank you. So what's that about?
So we are a team that work with citizens over a period of several months to build independent living skills. So we look at, we're made up of OTs and enablement assistants and enablement officers. So us OTs will go out initially to meet the person, and we'll listen to them. So we'll listen to what areas in their life they might be having difficulty, what areas they're finding that they're really good at, and then we work with them to design a plan of how they're going to achieve the goals that they want to achieve over that.
The goal we are setting, it could be anything from if you want to cooking something, you don't know how to cook. If you want to go somewhere, you don't know how to get there. If you don't know react in the certain situation, and so on.
Things like social dangers. So if you're going out and you're not sure how to react in different situations, that you might be at risk, or you don't know how to identify that you're at risk, we can work on those sort of scenarios and support that person to be able to identify risk and be able to keep themselves safe when they're out and about.
We also do this with online danger as well, the use of the internet, as well as general life skills within the home, as well as the travel training. Getting to places that are important to you. And as you were saying, it's a journey, isn't it? And at the end of this journey, you may have gained those skills, which is brilliant, but even if you haven't, then you're not left with nothing. We can then inform the social work teams if you have any ongoing needs that need to be met.
And if there's areas that you tell us that you are having difficulty or you want some advice, and it's something that is not an area that we support with, then we can signpost you to the relevant agencies or charities or whoever's the best person to give you that advice, really.
We could also, as Fiona said, signpost you to somewhere if you, for instance, looking for the opportunity, voluntary opportunity or job opportunity. We can signpost it to relevant people to step by step take you to the how you get ready for if the job be available.
So have you got any last message you wish to just to ease people who are going, these three ladies look really nice? Any last minute message that you want to send to anybody?
Just that we'll listen. So we're there to listen to you and listen to what your needs are, what your concerns are, and what you really want to achieve. And then we'll do what we can to support you to achieve those goals.
Yeah, and we are like yourself. Sometimes we don't know the answer for any your concern, but we try to find the answer, and we work with you to just get life better.
And I'd say that we do our level best to help you to achieve your goals. And I think the main message is this enablement that we do is for you. So you're in charge. So if there's something you want to do, let us know. Tell us, and we'll design everything around you.
It's what's important to you.
Exactly. What is important to you.
Brilliant. Thank you, guys. It's been really lovely. Thank you, and goodbye.